Continue to see a rise in our cases of COVID-19. This will unfortunately be the case for some weeks ahead. Today we want to update you on social distancing, PPE, testing, and alternative care sites. First, I want to remind everyone how important social distancing is. This virus clearly spreads when people gather together. I can't repeat myself enough. Virginians, you need to stay at home. If you do not have to leave your home, you should not leave your home. If you have to get a necessity, or if you are in a job that you have to be there in person, then go out to do those things. If you need air, walk around the block, or want to go to a local park for a jog, remember social distancing and staying 6 feet apart. But otherwise, I want to be very clear. You need to stay at home. That is the only way that we can slow the spread of this virus to give our medical system time to build its capacity to save lives. Everyone needs to stay home and to do that for the next few weeks at a minimum. That's how long it will take to bend that curve downward. If we don't stay home, if we act like this doesn't apply to us, we will literally see more cases. We'll see our hospitals overwhelmed. It is up to each and every one of us to do our part to save the lives of our neighbors, our friends, and our family. If you're staying home and are concerned about how to get food or access services, you need to call 211. That's the state's 24-hour hotline for information on how to reach our social safety net. So far, we've seen the most cases of people are in their 50s, 60s, and older. But we're also seeing cases in people in their 20s. For those of you that like numbers, we have 604 cases in Virginia, 93 of them. 93 of the 604 cases are in the age range of 20 to 29 years. That's 16% of our cases. So there has been some talk, and I have seen activity around Virginia that this only affects the elderly. Well, it doesn't. It affects all of us. So take this seriously, and please stay home. Localities have full authority to enforce these orders, and I expect them to do so. Now, let's turn to the issue of testing and PPE. The issue is very simple. We do not have enough testing materials and personnel protective equipment for our medical staff and our first responders. This is partly due to supply chain disruptions in Asia because of the COVID outbreak there, and it will take several weeks for that to get back on track. In the meantime, our country needs a national solution. Yesterday, I was on a call with President Trump, Vice President Pence, and governors from around the country, including our neighbor Maryland Governor Larry Hogan, chairman of our National Governors Association. Working also with D.C. Mayor Bowser, we're calling on the Trump administration to set up a federal testing site specifically for the Virginia, D.C., and Maryland area. We are home to the majority of federal workers, more than 360,000 across our 3 jurisdictions, and many of them work in critical agencies that must continue to operate. We have to be able to test these individuals in real time. Our specific region needs special accommodation for testing and bed capacity to support this population. Yesterday on that call, many governors, including myself, expressed concerns that PPE supply continues to be an issue. We're all out there bidding literally against each other. Here in Virginia, we're bidding against our own hospital systems, other states, and the federal government. And the federal government is bidding against 100 other countries around the world. The governors on that call repeatedly said that production and distribution of PPE really must be managed at the federal level. We strongly encourage the President to use the Defense Production Act to ramp up production of PPE. There is no time to waste. In the meantime, we've also had corporate citizens step up. Companies like Micron, Home Depot, and Dominion Energy have donated tens of thousands of PPE, and to those folks, I say thank you. For any company that has PPE they want to donate, please go online to virginia.gov/COVID-19 supplies. Let me repeat that, please. virginia.gov/COVID-19 supplies. Our Department of Corrections has made thousands of face guards. We're testing those to see what medical grade they are so we can assess how best to use them. And we're working with Virginia-based manufacturers to produce more masks and equipment in real time. Every state is doing the same thing. We're all trying to get our manufacturers to produce this equipment. But again, this really has to be solved at the national level. Now, let's talk about potential sites for emergency hospital beds. The Army Corps of Engineers has been working with our Department of Health and our emergency operations team to identify sites around Virginia that we can use if or when we need excess hospital bed capacity. I have been spending a lot of time talking to various groups, getting and giving updates on all of our efforts to work together to protect the public health. Yesterday, I spoke with our congressional delegation, and I want to thank them for supporting our request for federal funding for our National Guard emergency activities. Virginia's National Guard is helping move supplies and do other emergency logistics, and they are ready if we need to call them on further support. I've been speaking with faith leaders, business groups, doctors, hospital leaders, local government leaders, and my fellow governors, all in an effort to keep the flow of information open. As I've said before, I want to recognize the incredible service of all of our frontline workers. Our hospital workers, nurses, doctors, the greeters, everyone working in a hospital setting, our first responders, our grocery workers who are trying to keep us supplied, our truckers. There are a lot of folks serving the public right now, and we need them to keep our society moving forward. We also need to keep them and their families safe and healthy. I also want to remind Virginians about our Virginia Medical Reserve Corps. The VMCR is a force of dedicated volunteers who are ready to support the community in the event of a public health emergency. More than 1,500 volunteered just in the past month, and we had 650 volunteers in the past 2 days. I am so proud of Virginians. This kind of spirit is what makes us the best state to live in. The VAMRC is looking for healthcare professionals, 18 or older, both current or previously licensed, as well as students. So I ask you to please visit VAMRC.org if you're able to help. Once again, that is VAMRC.org. This weekend, President Trump is planning to visit Norfolk to see off the USNS Comfort, which will be deployed to New York to help that state with its coronavirus outbreak. As a Virginian and an Army veteran who served overseas treating wounded soldiers during the Gulf War, I know Virginians have always answered the call. We are home to the Pentagon, Quantico, and Naval Station Norfolk, the home port for the U.S. Navy's Atlantic Fleet. The Comfort will care for patients who need emergency surgeries, trauma care, or other medical care, freeing up beds and doctors at the hospitals in New York so that they can fight this virus. The deployment of the Comfort is a sacrifice for our personnel and their families, but I know it is one that they are ready to make. We are proud Virginia can help New York in any way. We're all in this together. That's why we continue to need everyone to stay home, stay away from groups, and do everything that you can to be safe and stop the spread of this virus.